The content herein is for informational purposes only, not intended as medical advice, diagnosis, or treatment, and is not to be substituted for direct advice from your doctor.
Today's LymphCast program is proudly sponsored by VitaSupport MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit VitaSupportMD.com to learn more.
Welcome to LymphCast, the show that brings together doctors, other health professionals, and special guests to discuss lymphedema, venous disease, and other associated disorders, and what can be done if this is affecting your life. Now it's time to sit back, relax, as it's time to learn all about lymphedema, venous disease, and associated disorders on our show, LymphCast. Greetings and welcome to LymphCast, episode number 9. Glad you're with us today for another exciting show on this whole topic. Let's meet our panel right away. From California, Dr. Emily Iker. Greetings, Dr. Iker. How are you today?
Hi, wonderful team and all our listeners. We are excited to have an incredible person today for our LymphCast show, and I will introduce him later, then after Dr. John Chuback.
Okay, that sounds very good. Let's bring in the founder, the originator of this show, the LymphCast show, also the founder and owner of VitaSupport MD, makers of Vein Formula 1000 and Lymphatic Formula 1000, from New Jersey, physician and surgeon, Dr. John A. Chuback. Greetings, Dr. Chuback. How are you today?
Hi, Paul. It's great to be back. Great to see you. I'm doing well. It's great to see Dr. Iker with us today. You know, we have such a busy team. I don't think Dr. Melin will make it today. I think he had a late OR case. I just got out of the operating room myself. And I know that Dr. Gloviczki is traveling in Istanbul currently, and I think it's the middle of the night. She and her husband, Peter, at a conference there. So we have still a great team with us, led by Dr. Iker. And I want to thank Emily personally for bringing our guest today. I won't make a spoiler alert. I'll let her make the introductions, but I want to thank her as always for her great support in this mission that we're on here with LymphCast and for bringing such a valuable and wonderful guest today. So thank you, Emily.
Well, it is my great honor to welcome Cam Ayala, who serves as a director of development and marketing for Lymphatic Education and Research Network, along with other titles. We just found out his birthday is coming up next day or two, and he will take us through the journey of his childhood when he was diagnosed with primary lymphedema affecting his right lower extremity at early age. He underwent significant challenges throughout his early days, and his lymphedema progressed so that he had to have several surgeries, altogether 17 surgeries. And unfortunately, all these events led to an amputation of the right lower extremity below the knee. For the listeners, I just want to say what is primary lymphedema. It is a lymphedema where the lymphatic system is not fully developed or damaged or absent from the birth and may occur even later in life, but it leads to a swelling of the lower extremity, usually one more than the other or just one. And in Cam's case, it was right lower extremity. We just talked about it, and we met in 2015 for the first time. So time flies. In 2019, Cam was a contestant in the Bachelorette and Bachelor and in Paradise show. And it was quite a show to see handsome Cam parading himself with a beautiful red rose. He's now using his notoriety to bring awareness to the lymphatic disorders. He is a great speaker. he attends many meetings with Lymphatic Education and Research Network, and he shares his story with us now. So Cam, thank you so much for being with us. You are an incredible human being, and thank you for educating not only public, children within your situation and a similar story, and also physicians who don't know much about lymphatic system yet. Cam, take it from here.
Awesome. Thank you so much, everyone, for having me on. An honor to tell a little bit about my story, some cautionary tales, but very much a roller coaster. I think that's pretty much the theme that any lymphatic disease patient can relate to, whether you have lymphedema, lipedema, a lymphatic malformation, lymphatic anomaly, anywhere in that continuum, it's this constant up and down, right? Because there may be seasons of your life where you're healthy, you don't have any bouts of infection, you may have a good diet, exercise, etc., and you feel like you have it under control. And then boom, next thing you know, you're struck with a different season of recovery, of downfall, and it's just this constant spiral. So if anything, I hope from my story, there can be some inspiration and really just some practical tips. And I will caveat that I am not a certified lymphedema therapist. I'm not a medical doctor. This is strictly anecdotal, and we'll have our great panelists here to maybe affirm some of the statements and anecdotes that I bring to the table today. And then, like all things with lymphedema or any lymphatic disease, a lot of it is trial and error. So I encourage you all to have an open mind, open heart as we listen to this journey. So I'll pass it back to the panels if you guys kind of have an area you want me to start with or a specific question, and we can kind of jump off from there.
I would have a first question. When was the first time you noticed you had something different?
Great. Yep. So basically, growing up in Houston, Texas, and that's where I reside now, I was a 3-sport athlete: baseball, basketball, and football. And at that age, really from, I'd say, elementary school up to high school and then college, if Lord willing, you're able to play at that level, that is how a lot of people, specifically men, develop their identity, is through sports, through athletics. And for me, I devoted most of my athletic ability and time to the sport of basketball. And it was around that 5th grade. So I was about age 11, about to transition into 6th grade during that summer. I was playing some, I guess it was just YMCA basketball. So not super competitive, but still full court up and down. And about midway through the season, a lot of the parents and coaches noticed that as I was running up and down the court, that it looked like I was limping. And we basically just kind of had an hypothesis that, oh, this is just growing pains, because I'm relatively tall. I'm about 6'4". And at that age 11 is where you start having those initial growth spurts for most kids that age. And I was definitely a taller one for my age. And so our natural reaction was just to go to an orthopedic doctor, get some x-rays, make sure everything from the bone integrity was, nothing alarming, right? And in that first x-ray, the first thing they noticed is that there was actually a leg length discrepancy. My right leg was about 1.5 inches shorter than my left. And beyond that leg length discrepancy, one thing we noticed on the x-rays was some black spots on the right distal femur. And at first glance, they couldn't tell if it was cancerous or a hemangioma. They weren't sure what it was. So what they wanted to do was a bone biopsy. And so when they did that surgery and removed just about a pinky's width of bone there from my distal femur to have it sent off for pathology, the pathology report did indeed come back as a hemangioma. So it wasn't cancer. And it was really in the recovery from that surgery that I started to present with what would be known as lymphatic symptoms. So essentially, as I was going through physical therapy, I would say about 2 weeks into the process, my right leg just progressively would swell larger and larger day over day. And, naturally, there's going to be some post-operative swelling with pretty much any orthopedic type of surgery. That's just kind of par for the course. But for it to get as worse as it did, as quickly as it did, it was kind of puzzling to the physical therapist. And again, this was in the year about 2000, 2001. So lymphedema was not a buzzword that you would hear, especially in physical therapy, if they didn't have the certification for treating lymphedema. So they thought that I was just getting stronger. They thought the muscle tissue was growing, but it didn't feel like that at all. So Fortunately, living in Houston is home to the Texas Medical Center, which I believe is the largest in the world. And having the, I guess, privilege, if you will, to have accessibility to some of the top physicians and specialists, I still probably went to about 15 or 16 different doctors, from infectious disease to a geneticist, primary care. And it wasn't until I came across Dr. Caroline Fife, who is a wound care expert, who is also specialized in lymphatics. She was able to identify that I had primary lymphedema. So, we talked about, Dr. Iker was talking about kind of how there's the difference between primary lymphedema and secondary lymphedema. And there's some patients with primary who present with those symptoms like right at birth. I mean, you can tell that they have an extremity or a part of their body that's just, disformed, or you see the port wine stains. If it's Klippel-Trenaunay-Wedber syndrome, there's a bunch of different lymphatic malformations and lymphatic diseases that can present right away. But for me, it took going through puberty and having that as the triggering event to really start my lymphatic swelling, and then ultimately getting the diagnosis and starting the complete decongestive therapy.
You progressed from the 5th grade without any complications until when?
So I was really, really disciplined at that age. So when I got the diagnoses, a lot of doctors who know about lymphedema, they will give you that long laundry list of activities and things to avoid, like abrasions, bug bites, paper cuts, things like that, that can exacerbate the lymphedema or put you at risk for infection. But when you're 11, 12-year-old boy who just wants to play contact sports like baseball, basketball, and football, and you live in Houston where mosquitoes run rampant, you really can't avoid those things. And I didn't want to have a lifestyle that was going to be so limited and constrained. I mean, it's one thing to be aware and to be cautious and to have a contingency plan and a support team in place in the event that one of those things does happen, which I was blessed to have. But one thing that it did require is a lot of discipline and self-care, right? Like, yes, I saw a lymphedema therapist and got the manual lymphatic drainage. I was bandaged. I got prescribed a daytime garment, a nighttime garment. I had a pneumatic compression. I was taught self-MLD, but never did it, right? I just relied on the pump and the garments to kind of do their thing. So that's one thing that I had to be really disciplined about, was keeping up with this, what I call the compression ecosystem. Because if I didn't, it's very much risk reward. If I didn't wear my compression garments or pump or do the other things that was recommended for me, my leg will progressively swell to the point where I wouldn't be able to compete in the sports that I love so much. But where my health really took a turn for the worse was actually after I graduated college and was in the quote unquote real world. I wasn't as athletic, meaning I wasn't working out 5-6 days a week. It was more like 3 or 4, and was more of a weekend warrior with drinking alcohol and partying and, probably eating pizzas and burgers and Taco Bell at 2 a.m. But that's where my health took a turn for the worse when I experienced my first bout of infection in the knee joint. Initially, when they ran the pathology, it came back as group B strep. And from 2014, that's when I had that first bout of infection. And we'll fast forward to 2020, I had 9 separate bouts of infection, which ultimately was then diagnosed with osteomyelitis. So a lot of times you'll hear a lymphedema patient talk about cellulitis, which is an infection that is relatively common and can be chronic in nature. But for me, I never once had a bout of cellulitis. It was osteomyelitis, so infection of the bone, which is more severe. So as a result of all those bouts of infection, I mean, bear in mind, I went to the Cleveland Clinic, the Mayo Clinic, all the different specialty hospitals in Houston where I live. I was even in Cedars-Sinai Hospital when I lived in Hermosa Beach. So I saw a lot of the top specialists, even the Boston Lymphatic Center, I was there as well. And the only consensus that we could gather with my particular condition was to stop these reoccurrences of infection. I did not want to be on 1,200 milligrams of amoxicillin orally every day for the rest of my life. That's what some infectious disease doctors gave as a prognosis. And I'm like, well, what about my gut health? Like, surely we can do better than that. We're dealing with the mechanical issue. Can we not fix it surgically? And so the best bet to basically salvage my leg with all the osteomyelitis episodes was to try a total knee replacement. So we did the total knee replacement in July of 2021, so 2021, so a little more than a year ago. And unfortunately, that surgery was, for lack of better words, botched. The hardware was positioned wrong, and it was the wrong size hardware. So when I was going through almost a full year of physical therapy, my flexion and my range of motion was just absolutely terrible because the hardware was basically clicking against itself. So I even had a manipulation done under sedation, which that hurt like hell waking up from that and still not having any pain relief. My lymphedema was getting worse in my upper thigh. So after a lot of deliberation and talking to a lot of different specialty doctors, even going to the Children's Hospital of Philadelphia, where Dr. Johan Dory, the interventional radiologist there, seemed to be one of the experts in lymphatic imaging. He did an MR lymphangiogram just to make sure we're looking at my entire system to see if we did this above knee amputation, that it wouldn't be a contraindication and that it wouldn't cause, I guess, more problems than were already there. And after doing the imaging, he basically said, yes, it is safe to do the surgery. So I had the above knee amputation surgery done in June 22nd of this year. So almost 3 months ago, and still very much in that recovery process.
Yeah, I made a mistake because before I said that you had below the knee amputation. So now we know it's above the, but I have one question.
Sure. For
all our patients, and as it's not a secret, I am a lymphedema patient as well in right leg. We tell every patient to be careful about the skin care, don't have any cuts on open lesions. And so what was the initial triggering point for you to have the first infection? Did you have open cut? Did you have open lesion? What happened?
That is the $1 million question, because I took really good care of my skin. And in fact, even on my compression garments when I was playing basketball is one of those contact sports where there's basically no padding like there is with football and some of the other sports. So as you know, especially those custom flat knit garments, those compression garments are very expensive, even with good insurance. And so I just remember, like, if I fell on the court and I would rip one of my garments, I'm like, oh crap, that's another $400. My compression garments were more than like Michael Jordan basketball shoes. So fortunately, I found a manufacturer who would put basically like a neoprene knee pad sewn into it. So that was like our safeguard to salvage the garments and help my skin stay healthy. But my hypothesis as to why that first infection happened, I think it was a combination of poor diet, right? So a lot of sugar, processed goods, I mentioned the fast foods and the pizzas and all that. A lot of foods that we ingest will cause inflammatory responses. So even if you don't have lymphedema, you may notice that your fingers are more swollen after you have something very high in sodium, or if you have a lot of sugar, you may notice some inflammation. So I was relying upon my youth of being 23, 24 and being tall and having a really fast metabolism to not like look overweight, but my diet definitely wasn't healthy. So I think it was the poor diet and stress that just overloaded my system and allowed that bacteria to thrive and ultimately go to the weakest spot in my body, which was that right knee joint, which had previously been operated on. And with osteomyelitis, oftentimes that bacteria can grow dormant in the smallest little crevices. So what they would do is they would open up my knee every time I had infection. They would clean it out. They would remove the synovial membrane. They would put me on a PICC line IV for 6 to 8 weeks. And hey, we would be clear. But then it would reoccur, like I said, 9 different times in the course of 7 years. So something deeper was going on and not responding to the antibiotics and the surgical intervention.
Today's LymphCast program is proudly sponsored by Vita Support MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit vitasupportmd.com to learn more.
What a journey you had to go through. And now tell us about the training with prosthesis. When was the first time?
So, yeah, I am very much a stubborn patient in the sense that I think it's just a product of my generation with the whole notion of instant gratification, right? So for me, one of the things that was really severe after my amputation was really bad phantom pain. And for the listeners who aren't familiar with phantom pain or phantom sensations, essentially, it's this weird neurological phenomenon where you experience real physiological pain in an extremity or a limb where it was amputated. So for me, prime example, the day after my amputation of my right leg, I had this severe, like fire burning sensation of my right ankle. And sometimes it would be stabbing, like knife pain. And other times it would be sensations like itching or ants. And so naturally our response is to reach down and comfort that limb or that extremity that's experiencing those pains. And it's just so trippy because there's nothing there. So there's different medications you can take, such as Lyrica, gabapentin, et cetera. And there's things like mirror therapy, where you literally put one of those tall mirrors in between your leg on the opposite extremity, and your brain literally thinks that your amputated full extremity is there by just simply looking at it and kind of reprogramming how your mind perceives those sensations and pain. So for me, the best remedy for my phantom pain and sensation was movement. So less than 2 weeks after my amputation, I was back in the gym doing CrossFit even before my prosthesis was molded, because they can't even start the prosthesis process until that surgical site is healed completely. So if you have staples or sutures or stitches, they have to remove those, because you're putting all of your weight on the base of your residual limb. So there can't be any open wounds there. And for all of the team involved, including the team at CHOP, one of our biggest concerns is like, okay, after this surgery, how is Cam's residual limb going to heal with the pre-existing lymphedema? Because, you know, lymphedema can be a big barrier to wound healing, because if the skin in that area just continue to be inflamed, the wound can't heal, it can't close. It's just common fluid dynamics, right? So fortunately, with wearing my shrinker and basically it's like a compression garment for the residual limb, when my prosthetist told me that, hey, you're going to have to wear this compression garment, I hope you're okay with that, I kind of laughed at him. I said, man, I've been doing this for 23 years. This is nothing for me. It's just a tinier version of the former full-length leg compression garments that I had. So wearing that basically 24/7 not only allowed the wound to heal faster, but it helped me get fitted for my prosthesis. So here's my first little socket here. It's basically where I know it's hard to see it with a virtual background, but it's where you put my extremity in there. And I have a cool little microprocessor robotic leg. So I am just so blessed to have had this surgery in 2022 versus heck, 15, 20 years ago, when they didn't have this kind of technology with prosthetics. So everything so far is going well. To kind of take it a step back, one of the diagnoses I was given from the Boston Children's Hospital was central conducting lymphatic anomaly, also known as CCLA, which in other words means they truly don't know how my lymphedema is going to progress. Am I going to start presenting in my left leg or any of my upper extremity? I've had a lot of lymphatic imaging done, from a lymphangiogram, lymphoscintigraphy, even IC green lymphatic imaging, ICG green. And there's no dermal backflow in any other extremities other than my right leg and kind of in my inguinal nodes and my central lymphatics. So sometimes I do have a little bit of genital edema, nothing too severe. I'm pretty good about wearing compression shorts as my undergarments. I don't ever wear like boxers or boxer briefs. I try to keep the boys compressed down there so we don't have any exacerbated swelling. So that's one thing that is probably the most nerve-wracking in all that I've been through, is knowing that I've seen the top specialists in the world and they don't really know what the future of my case is, right? Like at times I would almost wish, like, I wish this was a certain type of cancer where I knew my percentages. They had other patients, similar cases like mine, where we kind of know the course of action moving forward. We know treatment protocols. But for me, being an anomaly, I know God made us all unique and different, but in the medical community, when you're an anomaly as a patient, it is incredibly frustrating. So you really do have to be your own advocate. You have to listen to your body. You can't be afraid to experiment, and you kind of have to know what your limits are, but don't be afraid of limits, because sometimes you can push them in a way that's healthy. But that's a conversation you have to have with your lymphedema therapist, with your specialists like Dr. Iker and the rest of the panelists on here.
I have another question. How much fluctuation of the volume do you have in your stomach?
So believe it or not, is continuing to reduce in size, which is great because, I mentioned I wore the shrinker 24/7. So even with my socket, I would say that my socket, I don't have a gradient gauge in there. And that was one of the questions I asked my prosthetist, and he said, no patients ask me what the compression gradient of the socket is ever. I said, well, I am asking you that because of my lymphedema. I'm curious. So it's estimated about 30 to 40 millimeters of mercury compression gradient, which is the same that I was wearing for my custom compression garment. So I'm still getting that same compression on my residual limb. And just from, sheer body volume, I have way shorter of a limb now. So that's less strain on the lymphatics to pull that fluid from distal to proximal. So the volume, to answer your question, Dr. Iker, continues to go down. I don't know by what percentage. Typically the sockets, the first one that you get lasts on average from 3 to 6 months. I'm almost 3 months in. So when I go back for my 3-month visit, we'll have him remeasure me and I can give you an exact figure of how much it's gone down. But again, compliance is so important because there's a lot of veterans, for example, who get amputations and they get prescribed a prosthetic, but they refuse to wear their shrinkers or their compression garments, and their limbs, even if they don't have lymphedema, will continue to be edematous and they can't fit into their prosthetic. Therefore, they don't use them, and then they just be in the wheelchair for the rest of their lives or use crutches. And then there's the psychological downward spiral that happens with that.
I had few patients with lymphedema and amputation, and because of non-compliance, there was a fluctuation of volume. In the morning, they were better. At the end of the day, they were more swollen in the stump. Therefore, when they had to have a prosthesis fitting, they would persistently go either in the morning when the prosthesis socket was smaller. At the end of the day, it was larger. So another question I have, you had so much imaging done. Did they find lesser number of lymph nodes in the right inguinal?
So that's the thing about my lymphatic anatomy is from a nodal perspective on my left and right side, inguinal all over my body that has been imaged, the nodes are fine. There's no damaged nodes. There's no missing nodes. The lymph vessels distally look great. Where we have imaged, where we start to see the issue is in my inguinal nodes, and in that section, kind of here in my midsection, those lymph vessels are tangled up, almost like a garden hose. And when if you think about if you think about a garden hose, when you turn on the pressure and you have the fluid go from bottom to top, it's going to get caught up in that area. Which in my case, we've seen in ICG green imaging the dermal backflow in real time in my midsection. So unfortunately, that's not something they can just do an LVA on. At least I've had some of the top surgeons look at that. And you can't do sclerotherapy for that either. So just one of those weird things that I'm like just hoping and praying that something like this asbilostat trial that they're doing now at Stanford with Dr. Roxon, that I may be a candidate for that. But only time will tell to see from a medicine perspective if there's anything that can fix kind of what's going on in my central lymphatics, because I've even tried things like sirolimus that was prescribed to me from Dr. Cameron Trainer when I was at the Boston Children's Hospital back in like 2016. So I've tried a little bit of everything. That's what I mentioned earlier. You can't be afraid to do trial and error. And just because there's protocols that were written decades ago about bandaging, yes, those work, but I encourage all the people in the medical profession to think outside the box and to say, hey, just because this is the way something was, doesn't necessarily mean it's the way that it should be. Because, with anomalies like myself, it's so unfortunate that I live in a city like Houston, and we live in a time where we can send a man to the moon, we can turn a man into a woman, but we can't figure out the lymphatic system. And as a result of that, quite frankly, ignorance or lack of knowledge or information from the medical professional when it comes to the lymphatic system, I've had to lose my right leg as a result. But what I don't want any of the listeners to, because I've gotten a lot of messages on my social media from other lymphedema patients saying, oh, I have lymphedema, my leg hurts a lot. Do I need to get an amputation too? Well, I'm quick to remind them that, look, my case is relatively unique because of the osteomyelitis. It's not just because I had lymphedema that I had to get the amputation. So I want to make that very clear. And even before the osteomyelitis episodes, when people looked at me, they couldn't even really tell that I had lymphedema because I was extremely compliant, again, with the compression garments, with seeing a therapist, with exercise and pneumatic compression, and even wearing nighttime foam chip garments have served me really well from a management perspective.
Right. Well, what you had to go through your short lifespan, it's amazing. And I can only tell you that right now if I could teach, I will give you a lymphology not 101, 102. You are so knowledgeable and you explain everything so clearly to the public that definitely they will take pointers out of you. But you mentioned a very important aspect. Whether we have lymphedema or something else, nutrition, skincare, and self-care is so very important, because we have to, and lymphatic system, we know it's immune system. So we have to start from childhood with a good diet and good nutrition. And we are so blessed to have Dr. Chuback, who came with the lymphatic formula that with bioflavonoids incorporated into those pills. And I'm getting more and more positive feedback that patients do want to have more on a regular basis. And this is kind of benign, but it helps the lymph flow better. And again, nutrition, exercise program, and everything with the balance would help us, whether we have lymphedema, primary, secondary, or we are just slightly out of touch with our body and we need to get back and take care of self-care of our bodies. So you are an incredible challenge for all of the physicians, but now you have to just take care of yourself a little bit more and don't overdo, because I know you.
Yeah, and that's the balance, I'm always trying to find, because even with my lymphedema in my teenage years and wanting to play college basketball, which I did my freshman year, I was so hard on myself because I had such high expectations of the level I wanted to compete at. But the older I've gotten, and just looking back on my youth and realizing how much stress I was causing my body, I do have a sense of pride that I was able to still play at the NCAA level with lymphedema. And that's not something that everybody can say. And the really big challenge I would tell all the lymphedema patients I used to serve when I used to work for a pump company, when I would go and I would do the delivery and educate them a little bit just about lymphedema and kind of tell them about my journey, one of the questions they would always ask me was, well, Cam, how often do I have to use this pump? Or how often do I have to use my compression garment? And the answer I would constantly give them, I said, look, you're in a battle right now and you're battling gravity, and lymphedema and gravity don't take any days off. So consistency is so important, because you're never going to win the battle against gravity or lymphedema unless you're consistent, right? So it's almost like I would also give the analogy of the hourglass with sand. You tip it over, right? And if you don't compress and you slowly let go, guess what? That sand's going to fill in the bottom. And that's what's going to happen to your arm or your leg or wherever your lymphatic system's impaired. I mean, it's fluid dynamics 101. It's going to happen. It's inevitable. And then especially when you live in hotter environments like I do in Houston, when it's really hot and humid, you have environmental challenges. And then, as Dr. Iker saying, if your diet's poor, I mean, we are the embodiment of you are what you eat. If you have high salt and sugars, like I was saying earlier, and you're putting things into your system that's going to cause inflammation, and you already have an inflammatory disease, like that's the perfect tsunami inside of you. And there's going to be no way you can combat that.
Absolutely. Absolutely. Well, you are so amazing, and we wish you nothing but a safe journey with your next maybe 10 decades.
I hope so. Yeah. I mean, my next goal is wife and kids and all that, Lord willing. But I just want to continue to try to be a beacon of hope for lymphedema patients and now amputees. I'm in that community now, but I'm always an open book. So if anyone wants to reach out to me directly on my Instagram or Facebook, I'm sure they'll have it in the notes, how to reach out to me. I'm always happy to point people in the direction of Learn, where I work, or get them set up with LANA certified lymphedema therapist, or just wherever there's resources in their local communities globally. So I'm honored to have the platform and the ability to take my pain and repurpose it to help other people to not have to fight as hard as I've had to. Because Lord willing, if I do have a child who's born with a lymphatic disease or malformation, I don't want them to have the same type of barriers in the medical community and with their insurance, and then just with society in general. I want them to be equipped with all the tools to be successful, because that's what I'll close with. Lymphedema, lipedema, any lymphatic diseases, though they can be debilitating, if you catch them early enough and you're consistent enough, you can live a very active lifestyle. But it's really up to you to be your own advocate and to be your own best personal trainer. And there are resources out there. You just have to seek them. And again, we're here to help. And I very much want to thank the panel for having me on today. Enjoyed the conversation.
You are amazing, and we thank you. And I give the word to Dr. Chuback. I'm sure he has questions for you.
Sure.
And Dr. Paul too.
Yes.
Yeah, fire away.
What an extraordinary story. Obviously an unfortunate story in some ways, but of course Cam is so special in bringing such hope and optimism for not only others, but himself, to lift himself up and to bring on such a positive mental attitude, optimistic outlook, hopeful outlook. And I know that he's a person of great faith, and I'm sure that's very helpful in his journey. And that's a part of medical care and healthcare, which is unfortunately too often overlooked and dismissed in our culture. But for me, I see it as a very important part of the human experience, the psychological component, emotional component of disease. Everything is not managed in an operating room or under a microscope. And I have enough years in medicine as a cardiovascular surgeon and general surgeon to be absolutely certain about that statement. The first thing, before we dive into some more questions, perhaps, Cam, because we do have a little bit of time left.
Sure, absolutely.
I do want to follow up on what you just said and give you the opportunity, because I have personal experience with you, to know that you're very, very good in this way, excellent in this way, and responsive and sharing. Please share with our listeners and our viewers those various social media handles or emails where a way that they would be able to contact you directly, because I think that's such a generous gift that you're offering. Thank you.
And before I do that, it reminds me of a quote that my mentor, Joanne Rovig, who is the founder of Joby Pack, and a lymphedema patient herself, she reached out to me when I was 11 years old and has just been an angel and a great support. And she told me a couple of years ago that the purpose of life is discovering your gift, but the meaning of life is giving that gift away to other people. And so that's really the moral compass that I live under. I'm a man of faith, and I believe in having faith over fear. And with lymphedema or any of these lymphatic diseases, there's very dark days. There's days where you don't feel like getting out of bed. You don't feel like putting on your garments. You don't feel like doing those things that's necessary. But again, just be hopeful and try to muscle through those days. And, there shouldn't be such a disconnect between medicine and the pursuit of God and religion, but that's just how it is at times. And so I want to be respectful of all belief systems and just know that me personally, having something outside of myself to believe in is what's given me the strength I needed when I didn't have the physical strength to get through surgical recovery. So all that to say, if you want to reach out to me, I am very much an open book and will give you my unbiased opinions and, again, resources that can hopefully help you. And Instagram is probably the best way you can reach me. And my Instagram handle is Camron Ayala. So that's CamronAyala. And then just as easily for my email address, it's CamronAyala@gmail.com. And then Facebook as well. So pretty active on all platforms. And the life of a lymphedema advocate is a 24/7 job, and at times it can be exhausting, but it's incredibly rewarding and fulfilling. And just again, to be able to take my experience and help, be a light in the darkness for another person's life who may be going through a very tough season or journey with their lymphedema battle. But also there's a great amount of levity and rejoicing and just support in the online lymphedema community, which is very beautiful. I've gotten to meet some lifelong friends over the past 4 years or so that I've been active in the lymphedema online space. So don't hesitate to reach out, and I'm happy to give you any information that would be helpful for your case.
Vein Formula 1000 and Lymphatic Formula 1000 from Vita Support MD are backed by science and sold in doctors' offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
First of all, thank you for that, all of that. And I would like to pick up on some ideas that Dr. Iker and you obviously made out clear to our listeners and our viewers. The essence, the real essence of your story is in many ways just what an enormous challenge lymphatic diseases are. And that's why I give great credit also to people like Dr. Iker, who have committed their careers to taking on this very, very difficult and uncertain problem. When you go through your medical history and you mention some of the premier institutions in the United States of America, which also represent some of the premier institutions in the world, that we're all very well aware of on the panel, including the Mayo Clinic and the Children's Hospital in Philadelphia and the group in Boston and on, the Cleveland Clinic. These are highly educated, highly trained, highly professional, highly committed, serious physicians. And despite that, you had a problem, as you pointed out, which made you really a very, very unusual case. And there's sort of a sardonic joke in medicine that you never want to be an interesting case, but unfortunately, Cam, you wound up an interesting case.
Yep.
You were such an interesting case that you really traveled the country from coast to coast and from top to bottom with, in many ways, the best of the best. And despite that, had a very undesirable outcome for everyone involved, especially you. What this points out, again, is the need for this program and other programs like ours and other educational groups like Learn and Lana and on, who are really unknown to almost everybody in the medical community and almost completely invisible to people in the general public. But as you said, it is a small beacon of light, hopefully in a very, very vast darkness that is beginning to shine and take on a little bit more illumination and luminescence with time. But it really is one of the, in many ways, I think, one of the final frontiers of contemporary medicine for people who are faced with really difficult clinical circumstances like yourself. Lots of the lymphedema that we see is quite easily managed, as you know, and in the hands of an expert like Dr. Iker and her good care and so forth. People can live a full and very, very robust and rewarding and happy life until the end of their natural days. An outcome like yours is fortunately, at least in my experience, the two of you can correct me if I'm wrong, extremely uncommon, extremely rare, fortunately, but it does represent just another area of clinical medicine where the medical community needs further growth, further development, further expertise, more research, and so on and so forth. So we have those challenges in many fronts in medicine, but this is one that unfortunately, unlike coronary artery disease, arterial disease, peripheral arterial disease, and malignancy, cancers of all types, those are at the forefront of medical research, with a lot of money going into it, because there are tremendous numbers of people involved and affected, obviously, and in many cases can be life-threatening. But this disease, what's so frustrating about it, and collection or group of diseases, compendium of the diseases, is really, as I refer to it, and I don't mean this in a disparaging or disrespectful way, but sort of the bastard child of medicine, and certainly of vascular surgery. The lymphatic system is almost completely forgotten. The venous system only in the last 20 years has gotten some recognition. It's been sort of arteries all the way, and for good reason, because arterial disease can lead to amputations and has led to amputations in patients with atherosclerosis and particularly diabetic. So I don't think we've done too much about arterial disease, but I think we've done too little about venous disease, and now certainly lymphatic disorders. So I just wanted to share that again with the panel, with our guests, with our listeners, that we all need to kind of keep our voices up and loud and often, and bring more and more awareness to this very, very important and extremely challenging anatomical and physiological problem, because the solutions are not simple. In many ways, much, much more challenging in cases like yours than typical venous and arterial disease.
Right. And it's awesome that they have organizations like the American Venous Lymphatic Society, that they actually now include lymphatics in that conversation. It's not just venous. And that's where Dr. Iker and I got to meet in person a couple years ago again. So it all comes down to the medical school curriculum, because that's one thing we talk about at Learn all the time, is the average medical school student gets anywhere from 30 minutes to an hour of curriculum in the lymphatic system in their entire 4 years, right? I'm sure you talk more about sexually transmitted diseases than you do about the lymphatic system. And so that just blows my mind, but that continues to perpetuate young doctors graduating from medical school not being adequately trained and educated on how to diagnose and how to come up with better treatments than wrapping people with bandages like they've been doing for decades and decades.
Paul, as our non-medical doctor, who's doctorate in education, and our great moderator and our host, and as Emily mentioned, the person who takes care of all of our production and post-production work, Paul Reeves, I should say, has been a host and moderator in radio, terrestrial, and internet radio for many, many years now, and has had extraordinary guests of all kinds from every walk of life that you can ever imagine. So I wonder, Paul, if you have any comments or questions on this very, very interesting discussion today.
I have a few, and by the way, I'm glad you mentioned the radio show, because I've already written Cam's name down as a potential guest. I'll be calling you this week, Cam. So just so you know, you have a great story. And what I'm impressed with the most, of course, I'm not a medical person. That's the bailiwick of the other two people on the panel, but it's your overall attitude and your joy for life. I've seen people in your situation that just, okay, that's it, I'm throwing in the towel. I'll just sit here and watch Netflix until the party's over, and then it ends up being over fairly soon. What kind of, and I know you discussed your faith, you discussed you walk with the Lord over everything else, and he does take care of everything else, but beyond that, what kind of suggestions or advice could you give to people who are going through what you're going through, or have gone, or might go through it someday, in order to retain the joy and the zest for life, as you've clearly done?
Thank you, Paul. That is a wonderful question, and it actually makes me think of another lymphatic disease patient. He is a U.S. Coast Guard veteran, Mr. Kelly Bell, which Emily, I know you've met him before, Kelly, at other Learn events, and he just has an extraordinary story as well. And one thing that I've learned from Kelly throughout our years of friendship and just being advocates in this space is that he told me what changed the game for him in his life, being dealt a very bad hand, kind of similar to me, is that he found his peace. And finding your peace can mean different things for different individuals, right? It can come by way of relationship with your belief systems, with your religion. It can be with your friends, your family, physical health like exercise, yoga, deep breathing, all the things that actually can help your lymphatic system. For me, beyond finding my peace is letting people know it's okay to have those pity parties and to be angry and to just really be down and out, but you got to snap out of it quickly, because when you stay in that space, it's like quicksand, because sometimes the harder you fight, you just dig and you go down deeper and deeper and deeper. And I've had that in different seasons of my life when I wasn't a believer, when I was mad at the medical system for not finding a cure for my disease, when I placed more emphasis on vanity and not wanting to wear my compression garments out in public because I thought girls would judge me and not want to date me, etc. So my advice for everybody, whether you're a lymphedema patient or any continuum of lymphatic diseases, be consistent, because the future you will thank you later. And that's the biggest thing, is consistency. And I believe that compliance is very much binary. I don't think there's any gray areas. You're either compliant or you're not, because when you're not compliant, you're going to suffer the consequences. Like I was saying earlier, in the battle between lymphedema and gravity and you, those two forces, gravity and lymphedema, will always win if you don't keep them in check. So have a team in place, whether it's your local lymphedema therapist, your physician who actually understands lymphedema, having the right DME, the durable medical equipment provider, in place so you can get things like the right compression garments, the right pumps, any other things that are deemed necessary for your case. And don't be afraid to ask questions. I think a lot of times as patients, we have these evaluations with a doctor and they start spitting out these long medical terms and you forget. Like I even will record the evaluation on my iPhone. I'll get permission from the doctor, say, hey, can I record this? That way you can go back and listen. Do your own research too, because no one is going to advocate more for you than you. So you have to really take ownership of your own body, of your own case, because at the end of the day, you can be the driving force between getting those second opinions, those third opinions. Because if I listened to some other doctors 5-10 years ago who weren't really competent when it came to lymphatics, I would have been on very heavy antibiotics for the rest of my life. And I've been told that I should just take water pills, right? So that's another common thing that a lot of cardiologists who don't truly understand lymphedema or lymphatic diseases will just put people on diuretics. And I know there's a place for that, right? So this isn't me saying if you have cardiovascular disease and you're prescribed diuretics not to take them, but also, be sure that you're vocal about your lymphedema in all different medical appointments. So again, be your own advocate. It's okay to have bad days, snap out of it, and have a good support system in place so you can get through those bad days and really triumph over whatever disease state you may have.
Okay, well, yeah, excellent advice. Now, let me ask you this question, because each of us have had a time in our life where something went poorly, whatever it was, health, work, relationship, whatever. And what I've done in those situations, I've not had anything amputated. Your situation is much different than mine, but I decided, okay, something really bad just happened. And because I'm going to make a plan to move forward, this moment right now is the worst it's ever going to be. I'm not going to let it get any worse. It's going to get incrementally better to the point I'm sailing through life again. Did you go through any of that, even through the amputation process? Like, okay, this happened. Okay, all right, take it from there. Yeah, let's hear it.
So even prior to the amputation, when I had the total knee replacement about a month post-op, I was just in terrible pain, and rightfully so. It was the wrong hardware in there, but I didn't know that at the time. And unfortunately, I developed a blood clot. So I had a DVT, and that was extraordinarily painful. And it was on a random afternoon as I was recovering from my parents' house. It was so bad that when the paramedics came to rush me to the hospital, one of the EMS guys lifted up my leg, and when I screamed an explicit really loud, I won't repeat, it startled him and he dropped my leg onto the bed so hard that one of the stitches bursted. It was bleeding. They had to inject me with ketamine right away. And I had never had a ketamine infusion or shot before. And I'll never forget what the paramedic said. He says, "Mr. Ayala, I'm about to give you a ketamine shot. You may have an out-of-body experience. Don't worry, you're fine." So when she caveated with that, I'm like, okay. So she did that. And it was like I was in like a Quentin Tarantino movie or something, because I literally felt like my soul was leaving my body as these men were lifting me up on the gurney and getting me on the stretcher. And it was in that moment of severe pain that I had this crazy experience where I had basically an audible message from God saying, "Be calm, I'm with you." And I know not every listener is a believer, so this is not me imposing my religious beliefs on anybody, but it was in that moment of severe pain that really transformed my relationship with Jesus, and has really helped turn my life around since that. So I'm not saying that everybody's going to have a profound experience like that, but just know that when you can repurpose your pain, like anybody with lymphedema who has chronic daily pain, that's going to be your mechanism to get out of it. And again, having that support system around you, you don't have to go through it alone. And that's one other thing I will say that is a big issue with the lymphatic community, especially with secondary lymphedema. If you're given that diagnosis right after a cancer battle, for example, in my opinion, I feel that anybody who is diagnosed with lymphedema, lipedema, or any other chronic lymphatic disease, that they should be given the recommendation to go see a therapist, not a lymphedema therapist, but an actual therapist, because you're dealing now with a chronic disease that currently has no cure, right? So you're being dealt a hand that says, hey, you have this, it's progressive in nature, it's going to get worse, especially if you don't do anything about it. As a human being, to be able to emotionally and spiritually process that, you need therapy, but they don't do that, right? But if you're an obese patient and you're about to go through bariatric surgery, they make you go through therapy first. The insurance companies require it in most states. So why should it be any different for lymphatic disease, right? We're mourning. We're dealing with a major emotional life that we have to deal with given a chronic disease. So you should have the mental health to combat your physical, spiritual, and all other arrays and spectrums of your overall health, in my opinion.
I think that's absolutely fantastic advice. I couldn't agree with you more. And it's a big part of the discussion that I bring into the discussion with Dr. Iker. Many, many times we have this and we fully concur that the psycho-emotional, psychosocial part of this disease, like many diseases, but in many ways, this disease is special in that way, cannot be overlooked and must be addressed and must be treated. We have to be holistic physicians and treat the whole person at every level. So I think that's great advice. And my observation has been that on the various social media platforms, there are phenomenal social media groups, support groups amongst sufferers. And the reason I think that's so important, again, it may not be for everyone, but it is something to look at. If there are listeners out there who are not aware of that, there are many great groups, and Cam may be able to even point you in the direction of some of the right groups. But my observation, what a wonderful group of people, and the way that they lean on each other, and the way that they lift each other up, and the way that they support one another, because this disease is so poorly understood, not only by physicians, but by lay people, that I feel that there's a loneliness in it. People who suffer from this, even friends and family, it's hard for them really to relate. They don't know what to say. They don't know how to support them. They don't know whether it's real or not. They don't know if it's a real disease or not. They don't know if it's important or not. So you can have a great sense, my observation of my patients has been, of loneliness and of isolation, and being the only one in the world with this problem. And I think that these social media support groups can be, for the right person, very, very valuable, because it gives you this sense that I'm not the only one. There are others. There is someone I can talk to. And they do share great advice with one another, and experiences, good, bad, and indifferent. So I'm going to leave my comments at that. And Cam, maybe you can just remark on that last piece, and then Paul will wrap things up for today.
Yes, and I'm glad you brought that up because I have a huge caveat when it comes to lymphedema support groups. So especially on Facebook, there's even one called Lymphedema. Like, it's just very generic, and I believe it has like over 30,000 plus members and whatnot. And when I joined that, I noticed very quickly that there was this interesting dichotomy of positivity and negativity, right? And eventually the negativity started to outweigh the positivity. And so, like any media consumption, whether it's social media or major news networks, you have to go into it knowing that there's going to be some good stuff and bad stuff. And getting that discernment is something that's just going to take some time. But overall, though, as Dr. Chuback was saying, if you are feeling alone or isolated, it is a great place to go. And you don't necessarily have to participate in the conversation. You don't have to like posts. You don't have to comment. You don't have to create your own content. You can just go there and consume it and see what resonates with you. And you have to have a really good mental and emotional filter, if you will, because again, if there is a lot of that negativity on there and the whole woe is me, which I'm not trying to downplay a lot of those people real emotions, but at the same time, for my lymphedema, like I said, there's good days and bad days. I try to snap out of those bad days, and I try to have moments where we celebrate those victories. Like, I just ran my first mile with my prosthesis, or I woke up an extra hour early this morning so I could pump before work, so I'm not as swollen when I'm teaching kids, right? There's all these great people in those communities who can serve as beacons of hope, not beacons of darkness. So you just have to kind of go into those spaces with an open mind and realize that it's not all sunshine and rainbows, but there are a lot of gold nuggets in there that you can find if you just mine through a lot of the BS.
Yeah. And I think on this positive, beautifully said, positive notes, we want to thank you so very, very much. You are an inspiration to all of us. And just continue your journey. You are already healed with your stitches. Now start running.
That's next.
Take small steps. And we hope to see you at some meetings very soon. Thank you so very much. Thank you.
Thank you guys for having me. Appreciate it.
You bet. No, what a great story, valuable information. Again, every time we seem to hit a grand slam home run on this show. We want to thank our panel from California, Dr. Emily Iker. Dr. Iker, thank you very much for everything today.
Thank you. It was unbelievable joy to see you, Cam, and happy birthday, happy upcoming birthday, and many, 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 many happy ones and healthy ones.
Cheers. Champagne toast.
Yeah. Yes.
And we want to thank the creator of the show, also the founder and owner of Vita Support MD, which makes and distributes a Vein Formula 1000, Lymphatic Formula 1000, physician surgeon from New Jersey, Dr. John A. Chuback. Thank you, Dr. Chuback, for everything, creating the show, and for all of your input on today's show. Thank
you. Thank everybody. Thanks especially to Cam Ayala. Unbelievable journey, story, inspirational. And as always, I think I learned more today than I was able to teach, but that's all part of the process. So thank you again very much. Thank you.
And we want to thank everybody for listening and watching today. LymphCast episode number 9. Obviously, we'll see you next time for episode number 10, LymphCast show. Go out there and have a great day. And thank you for listening and watching today.